There once was a Muslim woman who has recently moved to America. Her English is minimal and she has no friends that could help her. One day, she suddenly felt pain in her stomach, and with the help of a neighbor, she was taken to a hospital. The woman was dressed in her traditional Islamic clothing, which consists of loose clothing and a hijab. She walks up to the front desk and the nurse says,
Hi, how can I help you?
Feel pain. Pain.
as she is pointing to her stomach.
Can you be more specific?
Pain. Out. Pain.
I need a little more. Okay, whatever. I'll call the other nurse so you could explain to her.
Please come with me. I'll do some preliminary assessments before you meet the doctor. Wait in here. He will be with you shortly.
Couple of minutes go by.
Hi, my name is Dr. Tan. I got my MD and PhD from Harvard School of Medicine and graduated with honors. I'll be your doctor today. What seems to be the problem?
No, man. No.
What's the issue? Can I get a nurse over here?
Yes, doctor?
What's the issue here? It seems like the patient isn't complying.
Patient points to doctor and yells.
No, man.
Oh, you don't want a male doctor? Well, the female doctors are too busy at the moment, so why don't I deal with you today?
He aggressively places her on the hospital bed to test her vitals by pressing the cold stethoscope against her and pressing against her stomach by placing his hand over her shirt to test if she felt pain when doing so. The patient was intimidated and went along, and she started to comply but was uncomfortable the whole time. In her culture, doctors are revered, so that played a role in intimidation. After receiving treatment, the patient leaves the hospital angry and embarrassed. She has decided to not seek healthcare in American hospitals ever again, and she developed a new kind of pain. The doctor failed to address the deity in the room. So what was the problem? In this scenario, the patient walked up to the first nurse and explained her issue. The nurse was dismissive and passed on the responsibilities to another nurse without trying to fully understand what the lady was saying. Once the patient met the doctor, she pointed at the doctor and stated wanting no male doctors. The doctor understood what she was saying but disregarded it without any attention to what reason the patient may be saying that she doesn't want a male doctor. The doctor aggressively continued his treatment without fully understanding the patient. There were religious violations occurring with the women, as women are not allowed to come in contact with men that are not in their family in the Islamic religion. The religion promotes separation between man and woman in all kinds of scenarios. The deity was in the room, and the doctor failed to notice it. To understand the deity in the room and understand its effects, we will explore two religions and understand how healthcare can help those respective followers. Let's see if we can pull some helpful information that can help us solve the problem that we were presented with the Muslim woman and her doctor. Finally, we will cover a paper that explains how healthcare directors view religion when making decisions regarding the patient's healthcare, which overall impacts the patient's outcome. So let's get started.
In order to provide quality care and improve patient satisfaction, one must have a thorough understanding of a patient's beliefs. The first religion that would be studied is Jehovah's Witness. Jehovah's Witnesses is a monotheistic religion that developed in the 19th century in the U.S. from the teachings of Charles Taze Russell. Charles Taze Russell's teaching started in late 1870s, where he began studying the Bible and his Christian faith. The religion then developed into studying and understanding the literal translation of the Bible. Over the course of his life, Charles Russell wrote 3 books that explained the Bible in its literal meaning and created an International Bible Students Association. Similar to other Christian beliefs, this religion believes in the Bible but does not believe in the doctrine of the Holy Trinity. The main entity of this religion is the Watchtower Bible and Tract Society of Pennsylvania.
Some patients are required to receive blood transfusion regularly, such as anemia, sickle cell disease, or other bleeding disorder. However, since Jehovah's Witness does not allow its followers to receive any blood transfusion, even under an emergency, they may get expelled from or ostracized by the religious communities. Therefore, when making medical decisions, practitioners should have consent with the patients or come up with an alternative medical option. And here we have a case example. If an adult patient is competent to consent to or refuse treatments, it is important for the medical practitioners to explain the consequences of not receiving blood transfusion, and all discussions should be carefully documented by the practitioners. On the other hand, if the patient is under 12 years old and the parents refuse the blood transfusion by the reason only of the religion, the medical practitioner may refer to the law called Children's Act to ignore the refusal and administer the blood transfusion, unless there is a medically accepted alternative choice available. If the case is not urgent, the final decision can be made in the court.
Jehovah's Witness has a firm belief in the oneness of God and rejects the belief in the Holy Trinity. There's also a big focus on making disciples to all of the nations. This means door-to-door teachings and warning people of the day of judgment. Another belief in the Jehovah's Witness religion is the importance of modesty. Men are clean-shaven and wear suits, and women wear dresses and avoid pants. This is in order to not draw attention and also follow the religion as close to the Bible as possible. Jehovah's Witnesses do not celebrate holidays that are believed to be a part of pagan practices. In the healthcare setting, patients that are Jehovah's Witnesses might have different preferences in accordance to their religion. Most Jehovah's Witnesses can accept medical and surgical treatments. They can also be prescribed standard medication and believe in prolonging of life. Jehovah's Witnesses do not accept blood transfusions and may require non-blood alternatives when needed. Like many other Christian beliefs, Jehovah's Witnesses do not believe in abortion and termination of pregnancy, unless it may cause harm to the mother. Another form of terminating pregnancy in the Jehovah's Witness belief is taking or using birth controls. For non-married individuals, procedures such as in vitro fertilization and gestational surrogacy are also considered adultery and avoided by the religion. Surgical procedures like organ transplants are of personal choice.
Lastly, healthcare practitioners should respect the religious view of the Jehovah's Witness. They should also understand the belief behind their decision. Medical discussion should be conducted as soon as possible to give sufficient time for legal advice or alternative medical options. Most of the case, Jehovah's Witness patient refused the blood transfusion just because of the fear of being ostracized by the religious communities. It is important to notice that patients with any administered treatments are confidential and will never be disclosed to any third parties, and all third parties do not have access to hospital records without the consent of the patients. It is also advisable if medical practitioners discuss blood transfusion with the patient privately and ensure confidentiality without any pressure from families and religious communities.
Another religion which has had a running past with the medical field is Zoroastrianism. Just for context, Zoroastrianism is a monotheistic religion. It originated around 1200 BCE in modern-day Iran. It was established and spreaded by the great prophet Zarathustra. it garnered so much attention that the ruling Persian empires actually adopted it to be the official state religion. And today it is practiced by around 200,000 people worldwide. One of the bigger themes of Zoroastrianism is the emphasis on soul or spirit versus flesh. While our body is temporary, this life serves only to lead the soul to its destiny in the next life. In turn, many of its followers focus on acting out of goodwill, fulfilling their duty in the religion, and sacrificing to prepare themselves in the coming life rather than the life they are living now. More about Zoroastrianism. The religion is dualistic. This means that there's a rigid goodness versus evil, similar to heaven versus hell. Now, the general belief or narrative is that there's an ongoing cosmic struggle between goodness and evil. The good, light, and spirit is represented by the god Ahura Mazda, while the other side is represented by a figure known as Angra Mainyu, which is symbolized by darkness, flesh, and evil. You can see the struggle depicted in the picture above. Circled in the middle are the humans, those who follow Zoroastrianism. These individuals and their actions play a huge role in the religion, as their active participation directly tips the scale in the grand struggle between the two sides. For example, for every good deed, prayer, or sacrifice, this would be assisting their god Ahura Mazda in the cosmic battle. Likewise, for every wrongdoing committed by humans, these actions would assist Angra Mainyu in the great struggle. Overall, the religion highlights the individual and their action, and it encourages the bettering of the individual and focuses on the nature of one's spirit in preparation of the next life. It's important to keep these beliefs in mind, as it gives us context to the way Zoroastrian patients think and how their religion impacts their actions.
The idea of healing is mostly concerning the spiritual body rather than the physical, and would include asking the environment for help or looking within oneself to get back to the original harmony between spirit and body. Therefore, physical cures may be dismissed by the patient, but not entirely unconsidered, as it could interfere with the spiritual process of healing. This impacts medical decision-making in terms of decisions for treatment and the recommendation for the recovery process in accordance to the individual's religion. Another form of belief within the Zoroastrian faith is that herbals are essential to healing, the main one being the Heoma plant. So medications would have to be monitored, as if mixed in with the herbals used, could affect the patient negatively depending on the use. Personal hygiene is also important within the faith, especially concerning bodily fluids, which are considered untouchable and to be disposed of immediately. Therefore, the patient would be very demanding and impatient with the disposal. This could impact the decisions of surgery, as bodily fluids may not be disposed of immediately. And if the patient or their family refuses surgery when needed due to the Western ways of medicine, it could be harmful to the patient, unless there is a middle ground between healthcare provider and patient. The decisions on diet could impact the recovery process, because there is a difference to what some cultures may eat in comparison to what Western culture is used to. In terms of preferred gender of the healthcare provider would possibly be another factor. However, most of the time it does not matter to the patient. Overall, healthcare providers should be prepared to find other forms of treatment, as certain treatments could interfere with the patient's religious beliefs.
With all of this in mind, let's address the potential preferences when attending to a patient. Prayer is a core component of a Zoroastrian's everyday life. The act serves as a way to meditate, worship, and communicate with the god Ahura Mazda. Typically, in a life or death situation, prayer is used to call on God for a good recovery. It is then important to allow patients to pray, if requested, as it is a method of recovery in their culture. Clothing is also a very big part of the religion. Based on age group and sex, different sacred garments are given to denote an individual's role in the religion. The white garment showed above is called a sudra. This garment is usually paired with a cord called a kushti. Patients may request to wear these garments while hospitalized, since it carries such great significance in the religion. It may invoke a feeling of soothness, positivity, and even a comforting feeling for them. Because of this, it's important to be very sensitive about damaging the patient's clothing, and out of respect, these patients should be allowed to wear these when possible, and workers like us should refrain from cutting through the garments if not necessary. In Zoroastrianism, there is a specific tradition that one must follow when caring for those during their final hours and for when they pass away. For example, donation of organs is preferred to be done during the dying process rather than after death. Another example is the funeral ceremony itself. The ceremony should be held within 6 hours after death, if not less than 24 hours. If possible, we should be able to meet these expectations.
In terms of religious incorporations, healthcare providers should ask if there is a special case in terms of clothing, and if there are any rules to it so that there is a form of sensitivity. Religious attire is very important, especially to patients of the Zoroastrian faith, and should not be cut unless of absolute emergency, such as serious trauma. The wearing of traditional clothing could also help the patient's mind while the physical healing process occurs. Another thing healthcare providers can do to incorporate spirituality and religion into a patient's healthcare is to allow patients their freedom to prayer. It is also essential that the family and minister are present. This would also be a positive to the recovery process. When a patient passes away at the hospital, healthcare providers should also allow the family to do the traditional time of prayer in silence. Space is not usually needed, just a silent room. As a whole, just being able to listen to the patient's beliefs and faith can build a better bond and trust between healthcare provider and the patient, as also helping the patient become more comfortable from what they are generally used to. Learning the boundaries of religion, such like prayer, and providing a range of spiritual care for the patient is essential.
With anything, it's always important to be informed and educated on a patient's background. For example, as we discussed earlier, preparation of the dead plays a big role in Zoroastrianism. While many are familiar with the modern medicine and the benefits of autopsies, it's also important to respect their traditions. Many traditional followers of Zoroastrianism will ask for their loved ones to be buried within 6 hours of their deaths. In turn, it's just important to do so if asked. Simple acts like this, along with being open to prayers and other remedies, it plays a part in building a mutual relationship between the healthcare provider and the patient. By respecting their beliefs, it strengthens the trust between the two cultures, leading to a better future interaction.
So now that we went and explained both Jehovah's Witness and Zoroastrianism, let's go over a paper that may help explain the correlation between spirituality in healthcare and patient outcomes. This paper was made by Kathleen Gaelic, Kevin Flannelly, Harold G. Koenig, and Reverend Sarah L. The title of the paper is as follows: Referrals to Chaplains, the Role of Religion and Spirituality in Healthcare Settings. To start off, the researchers pulled an electronic list that contained names of different directors from the healthcare field. 4,000 names were pulled from that, and each were sent with a questionnaire. Out of the 4,000, only 1,500 questionnaires were returned. The type of questions asked on the questionnaire was: how religious are you? How spiritual are you? How important it was for team members to refer patients to chaplains under various situations. About 15 situations for potential referral were listed, which was based on previous research made by Flannelly and his team in 2003, 2004, and in 2005. This table here shows the demographics of the people who were given the questionnaire. The categories were nurses, social workers, physicians, and chaplains. Their gender, age, education, and region of US was recorded as well. Next, we have a table that shows 14 of the 15 situations listed on the questionnaire and reasons why directors may refer to patients to chaplains. These 15 situations were categorized into meaning, loss, and death, treatment issues, pain and depression, and anxiety and anger. Using factor analysis, they reduced a large number of variables into fewer numbers of factors. The Cronbach's alpha measures how closely related the situations are as a group. Table 3 shows the mean importance of referring patients to chaplains for different types of issues by discipline of the directors. The M stands for the mean, while the SD stands for standard deviation. As you can see, pastoral care had higher mean of importance of referring to chaplains for all categories. Medicine, on the other hand, showed the lowest mean of importance in all categories. Table 4 shows the mean importance of referring patients to chaplains at different types of hospitals. Psychiatric hospitals rated all 4 categories of referrals lower than did other hospitals. All hospitals agreed that patients should be referred to chaplains for issues related to meaning, loss, and death. Finally, we can discuss the results. We can summarize that each director deemed it important that referral to chaplains for issues related to loss, meaning, and death. The other issues were significantly lower, with anxiety and anger being the lowest.
Pastoral care directors had higher importance ratings. Directors working at religiously affiliated hospitals referred to chaplains the most, while psychiatrists referred the least. Psychiatrists tend to be less religious than their patients, and it's possibly due to Freud's hostility toward religion. Lately, though, psychiatry has become more open to religion and spirituality. In conclusion, a study done by Silvestri in 2003 was done on patients with lung cancer. It turned out that the patients had religion as the major factor that made them decide in taking chemotherapy. This was only second to oncologists' recommendation. Compared to the other options, physicians believe that basing chemotherapy decision on religion is the least important. It will behoove healthcare professionals to acknowledge the role that religion has in the patient decision-making and should take that into consideration. Instead of ignoring religion, which has been seen as some sort of antithesis to science, the doctor should be accommodating to the patient. Doctors need to revert to becoming a more compassionate doctor and return to the caregiving roots to strengthen the patient-doctor relationship.
There once was a Muslim woman who has recently moved to America. Her English is minimal and she has no friends that could help her. One day, she suddenly felt pain in her stomach, and with the help of a neighbor, she was taken to a hospital. The woman was dressed in her traditional Islamic clothing, which consists of loose clothing and a hijab. She walks up to the front desk and the nurse says,
Hi, how can I help you?
Feel pain. Pain.
as she is pointing to her stomach.
Can you be more specific?
Pain. Pain.
I seem to not understand the whole problem, so let me call a translator so we can better understand the problem.
She rings the translator. The translator picks up. The patient then explains to her what her problem is, and now...
I get it. Okay, let me do some preliminary tests so I can have you see the doctor.
The nurse conducts her preliminary tests.
Alright, we're done. Come with me. Here you go, and the doctor will be here shortly.
Hi, my name is Dr. Tan. I got my MD and PhD from Harvard School of Medicine and graduated with honors. I'll be your doctor today. What seems to be the problem?
She tells the translator the issue, and the translator relays the message that the patient doesn't want a man treating her.
Oh, look, I totally understand, but unfortunately, our female doctors are currently busy. Say what? Let me refer you to another clinic, and they'll gladly accommodate for you. If you're not in a life-threatening situation, you can wait here for the female doctor, but it may take some time. Is that okay?
The patient's uneasiness lifted as her shoulders relaxed. She was happy that the people in this clinic tried their best to get her right. They respected her religious traditions and cultures, tried to get educated through the translator, and didn't pressure her into making a single decision. She waited for a female doctor and received amazing health care. It was amazing because the doctor showed compassion and had caregiving roots to enhance the patient-doctor relationship. The doctor saw the deity in the room and decided to respect it, despite the differences to its own. Thank you for watching our presentation, and I hope you took something out of this that could help your future healthcare professions. Good luck!